Welcome back. Well, cold and flu might be talked about more frequently this time of year. Ear infections also a pretty common issue.
In fact, most kids will have at least one ear infection by the time they are 3 years old. And joining us today to talk a little bit about ear infections and all the other bugs that are going on right now, Dr. Stephanie Hansen. She's a pediatrician at Sanford Health. Thank you for coming back. And in the commercial break, I was like, oh my goodness, let me tell you about my sick kids. I feel like there have been a lot of bugs going around.
Yeah.
But ear infections, that's kind of a common one that a lot of families deal with.
Yeah.
What causes it?
Yeah. Well, you know, ear infections typically start with a cold or an upper respiratory infection, and then the ear infection comes on as a result of that. So fluid builds up behind the middle ear, behind the eardrum, and gets inflamed. There's a lot of pressure. There's pain. It can be pretty uncomfortable for kids.
And not a whole lot you can do to relieve the pain right away. You need to, typically, you have to go on antibiotics?
Not always, actually.
Okay.
And that's kind of some newer thinking with ear infections over the past few years. It depends a lot on the age of the child, their history with ear infections, how severe the infection is. They may not actually need antibiotics because some ear infections are caused by viruses.
Okay, I didn't realize that. So what can you do to make your little one feel better?
Well, there actually are some really good techniques you can use at home while you're waiting to kind of decide if they need treatment or not. Over-the-counter pain relievers are a great option. So using something like acetaminophen or ibuprofen in the recommended dose for your child's weight really can bring them some relief. But some of those old grandma tricks like using a warm washcloth or a cool washcloth on the ear, that can really help bring some relief too.
Okay.
At what point do you finally go, okay, you know what, we got to take you in and see a doc?
Yeah, you know, I think if you have a child less than 2, especially with a fever, and you're suspicious of ear infection, that's worth getting checked out. But any child who has severe pain that you're having trouble keeping a handle on at home, if they have a fever that's lasted longer than 3 days, I think those would be reasons to go in, and especially if they've had a history of recurrent ear infections. That's another instance where you may want to go in and be seen.
You're talking about fevers. When they're babies, you're always looking for if they're pulling or touching on their ears, but symptoms can really vary.
Yeah, you know, some kids will have just a feeling of kind of pressure or fullness in their ear. Other kids will have really intense pain. Some kids might have drainage from the ear, some might not. So it really can vary.
And what if you don't bring your child in, or can it, you know, what happens if you don't treat it when it needs to be?
Yeah, well, like I mentioned, a lot of ear infections are actually caused by viruses and will get better on their own. So if you do those treatments at home, relieve the pain, you know, do the warm or cool compress, and their symptoms get better, I think that's a sign that their ear infection got better.
But what if it doesn't?
If it doesn't get better, you know, if you're not getting a handle on the pain or if that fever persists, better head on in and get it checked out.
And you mentioned this. What if kids are seeing, you know, they have one every month or every couple months? Because when do we start talking about tubes or some different changes?
You know, if you've had multiple ear infections over one cold and flu season, or you've had fluid that's lasted behind the eardrum for 3 months or more, we usually recommend that kids have a consultation with an ear, nose, and throat doctor to talk about the possibility of getting ear tubes.
Okay. Is that common still?
Very common still.
Okay. Like how often, how many times in your practice do you see kids?
I think every week I refer kids to have a consultation regarding ear tubes, and it's probably one of the most common surgical procedures we do for children.
Okay. And, you know, just going back, it's been a tough season for all of us, but especially kids, right?
Yeah, it really has. You know, spring is here, the weather's warmer, the sun is out, but there are still a lot of viruses circulating in the community. So still seeing some influenza, still seeing RSV, strep is definitely present, and then some of the stomach viruses, which cause vomiting and diarrhea, those are present as well.
Oh my goodness, you are, I'm sure you are busy. I was going to say, my daughter, one of my daughters, not both, just one had strep twice, and now my niece has strep. So are you're seeing a lot of strep still? When does it slow down?
You know, during these winter months when we're all cooped up inside and kids are going to school, I think that we do see a big increase in those viruses and bacteria over the winter. So hopefully, you know, once we move into spring and summer, school ends, I think kids are going to be feeling a lot better.
Are you still seeing a lot of influenza A? Because that was, I talked to doctors and teachers. Teachers say, oh my goodness, we have so many kids out.
Yes, absolutely. That season continues.
All right. Wash your hands and sneeze into your elbow, kids, please. At least try. Well, Dr. Hansen, always so great to talk to you. I appreciate your time.
All right, coming up on today's show, how many credit cards should you have? What should you use them for? We'll talk about that right after this.
If you're